Many people do come to my clinic when they have an arthritic shoulder and they want to talk about something called a resurfacing hemiarthroplasty. And pretty much that is when the ball of the shoulder you end up replacing with a metal component. It's when people have arthritis. It's something that it kind of gained popularity in the hip and we started using it in the shoulder. But moving forward, we do that less and less now because what we found out is if you just replace the ball and you don't replace the socket, you still end up having pain because you have a metal ball rubbing against the bone of the socket. So all the data has shown us that if you're going to go down that road, you do much better having a total shoulder replacement, which gives much better function and much better pain relief moving forward. When people talk about a resurfacing hemiarthroplasty or a total shoulder replacement, we're pretty much talking about the same thing. A resurfacing hemiarthroplasty, you would just kind of replace the ball and you wouldn't do anything to the socket. A total shoulder, we just end up doing both. You end up replacing the ball plus replacing the socket. Kind of almost the same description, just for it's kind of a more technical side of things when we're talking about it. People do really well when you end up having a shoulder replacement. I have a lot of patients that come in saying, I read online that the resurfacing hemiarthroplasty is great. I'm younger, I'm active, I want to keep working out, and I spend a lot of time educating my patients that a standard shoulder replacement achieves the same goal, and the data backing it up shows that it lasts longer and actually works significantly better.